first listen. Shut up and listen. That's what I always told medical students and residents. Just shut up and listen. Usually the patient will tell you what's going on if you just be quiet. So if somebody's really scared, the first thing is to listen carefully, attentively. Don't be dismissive. Ask appropriate questions. If something seems like there's a loose end, pursue it. Because the more of those loose ends you pursue, maybe you come up with a diagnosis. It's not going to be something obvious because the patient's already seen 3 doctors. Listen, be compassionate, and do the follow-up questions and do the appropriate physical finding. I mean, you do physical examination starting from the hair roots all the way down to the toenails. You look at everything. Judicious use of laboratory testing, sometimes. Clearly the least important of the 3. History is most important, physical examination quite important, laboratory, And then you do something that is really at a premium and not very often done. Think. Think with an open mind and an open heart. And then maybe you come up with a diagnosis, or maybe you come up with a differential diagnosis that allows you to root through things. And ultimately, if there's no disease process that you can identify as an infectious disease, as an autoimmune disease, as an inflammatory disease, then maybe it's not that the patient's crazy. It's not that it's in her head. It's that there is an ongoing and endless tape of anxiety playing in that person's brain. And now what we have to do is deal with it. Understand the root of it. Try to get rid of it. It's not to say that they're crazy. It's not to say it's all in their head. It's to say that the confluence of everything that's happened has resulted in an ongoing problem that has no physical cause that I can identify. And of course, the patient can go off and look for another doctor. But at that point, that's my approach.